Hey folks, Dr. Ed Williams, I'm a facial plastic surgeon. We have Dr. Rhodes here. He's going to assist me. And you know, we get a lot of questions about what is a true deep plane facelift. And certainly we have this in a video format in our YouTube video for those surgeons trying to understand how to do a deep plane facelift. But it's pretty graphic. And so what I wanted to do is to show in kind of layman's terms what a real deep plane facelift. And I certainly don't want to make disparaging comments about my colleagues who say they're doing a deep plane, because a lot of people, that's a new buzzword. Well, I'm doing a deep plane, but it's definitely a more challenging, more difficult surgery, but in my opinion is much, much more effective. And so I wanted to put this together, this little mannequin demonstration to show you what a true deep plane facelift is. Now, if you look at this here, this represents the skin, okay? And underneath it, you've heard this word SMAS. That's the submuscular aponeurotic system. And that is a layer that is contiguous with the platysma, the muscle in your neck, and up here in the temporal parietal area. But basically, this is the fascial layer that we work on. Now, on the skin surface, you see a jowl, and you see some deepening of this nasolabial fold. So when we do the surgery, the traditional surgery, you lift up the flap. You see, actually the older facelift surgery is just pulled the skin. But as you can see, with this wrinkle in the underlying SMAS, just pulling the skin tight is not going to give an effective elimination of that. You can still see that lump in there, just like having a pillow in a bed, right? So I'm going to pull this over here. Let's assume when we're doing surgery, we are reflecting this. The most common technique used in the country is what's called an imbrication technique. And what that means is we take a little strip out of this SMAS, and then we tighten it a little bit, and then we lay that back down and we lay the skin down. So I'm going to show you what that looks like and why that's different from a true deep plane lift. So I'm going to go ahead and just demonstrate this by taking a little strip of the SMAS out. I got to get a hold of it here. Okay, and so here I'm taking this strip out of the SMAS. I got Dr. Rhodes over here chuckling a little bit. Just like in church, you know, when you're not supposed to laugh, right? Alrighty, so we're taking our strip out of the SMAS. And this is, again, probably the most common way to do a facelift in the country, okay? And this is called an imbrication technique, imbrication. Now, you can see that you can actually tighten this SMAS up, okay? You can tighten this SMAS up a little bit, but the problem with it is there's resistance on where the ligaments are, and when you pull the skin back, you're still going to have a little bit of a lump, okay? It's not as effective, I should say. There are people saying they're doing the deep plane lift, and what they're actually doing is they're kind of going into here and they're spreading, okay, they're spreading this tissue to try to release this a little bit. But a true deep plane facelift, and I'm going to show you this, carries this dissection further up here, okay, and cuts these little ligaments. And I'm going to show you something. When we cut these ligaments, okay, all these little ligaments here, and cut these little ligaments here in the face, and take this down further into the neck, which is what we do now with our deep plane lift. I want to show you something. Look what happens to the SMAS. Okay? Now we trim this all, but look what happens to the jowl, and more importantly, look what happens to that jawline. Okay? So it restores tension in this direction, but more importantly, you get all of the tension on the SMAS, repositioning things back where they should be, because this SMAS is what stretches out. We trim this. I'm not going to bother to show you all that right now in the interest of time, but then the skin really redrapes, and it's a much more youthful jawline. It softens this fold and addresses the mid-face. So I hope that's given you a little bit of an understanding as to what a true deep plane facelift is as compared to the imbrication technique, or what some people call a subsmash. And I would encourage you to really ask your surgeon if they're releasing the ligaments and repositioning the skin, or are they just taking a strip and undermining it a little bit. So hope that that's been helpful for you, and thanks for watching my video.